We are from Apollo Hospitals, Bangalore. So, Hosur being a very important place for all of us, we thought we will start our Apollo Stroke Clinic. So, in the same time, we thought we will give some information about stroke, which is a very serious neurological condition. If you see stroke, in India, every year, if you see the ICMR statistics, the government statistics which was released 2 months back, every year 20 lakh people are suffering from stroke every year. And if you see, almost 27% of them are dying. Like almost 6.5 lakhs to 7 lakh people are dying with stroke in India every year. It's a very big number. If you see globally, stroke is the second leading cause of death after heart attack. And in India, it is a third leading cause. If you see only stroke and heart attack, if you see only these two diseases, it contributes to 30% of deaths in India. So almost 1 in 3 deaths are because of these two diseases. So it is very serious brain condition. And among all the neuro condition, if we see 70% of the hospital admissions for a neuro problem is because of stroke only. So that's where we have to be aggressive in identifying the stroke symptom. We have to treat these patients. So last 15 to 20 years, there has been a total change in the stroke treatment. The concept of golden hour has come. Golden hour is first 4.5 hours after acute stroke. If you shift the patient to a stroke ready hospital, you can actually patient can go home. They can do, we give a clot busting medicine called IV thrombolysis. This we have been doing from 2008, but now because of the government push, because of public awareness, it is much better. So almost 20% of the people are coming in golden hour after stroke now, but it has to improve because only 20% means only 1 in 5 stroke patients are coming in golden hour. So that number has to increase. If you see in Singapore, if you see in Germany or America, that number is 50 to 60%. So our numbers are still less because of lack of awareness. So that awareness is doctor's responsibility. It is responsibility of the government. It is responsibility of the media to spread awareness. This is where, if you see Apollo hospitals in Tamil Nadu, it runs the largest stroke program. So what is stroke? Stroke is basically because of either a blood clot in the brain or bleeding into the brain. Brain usually is supplied by four major blood vessels. There are two in the front, they are called carotid arteries, which supply 40% each. If you see two blood vessels in the back, that is called vertebral artery. So if there is a blockage of one of the blood vessel, so that will cause clot in the brain. If there is a clot in the brain, the surrounding nerves will die. So because of the death of the surrounding nerves, usually patient will have either weakness or loss of speech or various issues. Now, how do you recognize stroke symptom? That is very important. We always tell what is called be fast, be dash fast. That is the synonym for public. B means balance. If patient has sudden loss of balance, that could be a symptom of stroke. Then E for eye sign. Suppose patient has blurring of vision, double vision, loss of vision. So that is one important feature of stroke. Then face means you all know the facial deviation, which is very commonly seen, very easily recognizable. If there is a facial deviation, that is also stroke. Then A is arm weakness, arm or leg. That is the paralysis part. So if there is no major paralysis, if there is a total paralysis, patient cannot lift the hand. But suppose if there is a mild weakness, what you should do? Ask the patient to keep the hand like this for 10 seconds. So usually if your strength is normal, it will not move. Suppose if your strength is weak, it will start drifting like this. So we call it as arm drift or arm weakness. Then S stands for speech. Speech can be loss of speech or sudden you cannot talk, you cannot understand, you cannot make a sentence and all that. T is time to act fast because there are studies wherein it is proven that every minute after acute stroke, 1.9 million nerve cells are dying every minute after stroke. So if you don't treat a stroke patient properly, he will get older by 3.5 years. So it is a significant problem.